Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha. 7th of April is observed as World Health Day every year. Started by the World Health Organization, the WHO, in 1950, the day highlights pressing global health issues and mobilizes action to improve public health outcomes. This year, the theme of World Health Day is Healthy Beginnings, Hopeful Futures, focusing on maternal and newborn health, urging countries to end preventable deaths and prioritize women's long-term well-being. Aligning with this vision, the Government of India, through the Ministry of Health and Family Welfare, continues to strengthen its commitment to equitable, accessible and quality healthcare. Over the past decade, India's health sector has made notable strides through initiatives like Ayushman Bharat and the National Health Mission, which have improved maternal and child health, expanded digital health access, and also enhanced infrastructure and services. To highlight these efforts and their impact, we have with us on this broadcast a very special guest, welcoming Ms. Anupriya Patel, Union Minister of State for Health and Family Welfare. Thank you, ma'am, for your time. Welcome to Sansad TV.
Thank you so much.
Since the theme this year on World Health Day aligns with something that India has been working on in recent years and made significant strides, let's begin talking about this notable achievement that India has been able to achieve in the field of maternal and child health care, and especially if you can walk us through some of the key interventions of the Government of India in this regard.
Well, to begin with, thank you very much for having me on Sansad TV on a very special day, World Health Day, and this year's theme is very close to my heart, maternal and newborn health, because like the rest of the world, India has also been grappling with this challenge for many years, and I am glad that we've made remarkable strides and considerable progress vis-a-vis the rest of the world. We at Government of India believe that every woman in this country and every child in this country, what they deserve is access to good quality health care and bright future. So I would like to actually talk about India's achievement first, because we've made concerted and systematic efforts over all these years which have borne fruits. So today, when you compare India's position with the rest of the world, insofar as maternal deaths are concerned, the rate of decline of MMR is around 83%, but the global rate of decline is merely 42%. Infant mortality rate in India has declined by 69%, and in the rest of the world, it's gone down by just 55%. Similarly, under 5 mortality in India has come down by 75%, whereas in the rest of the world, it has come down by 58%. So this is not some magic that has happened, but it has been lot of consistent efforts which government has made. We adopted a framework which is called the RMNCHA, which is the Reproductive, Maternal, Neonatal, Child and Adolescent Health. So guided by this framework, we try to encourage institutional deliveries. We try to encourage our women to go for ANC checkups, minimum 4 ANC checkups, and then avail the specialist consultation facilities also under Pradhan Mantri Surakshit Matritva Abhiyan. We have the Janani Suraksha Yojana, which encourages institutional delivery, and there is absolutely free, no expense delivery, where we offer free diet, free drugs, free consumables, free transport, free blood transfusion facility, everything under our scheme Janani Shishu Suraksha Karyakram. And one major concern has always been the high risk pregnancies, which we try to track until a safe delivery is achieved, which is under the extended PMSMA scheme, wherein we provide 3 additional ANC checkups to pregnant women. Coupled with this, we have also tried to provide safe, affordable and legal abortion services to women, and also facilities for postpartum care. So all these efforts, when made in totality, have made us reach the numbers that we so proudly announce to the rest of the world today. Similarly, insofar as the newborn health is concerned, the young children are concerned, India, particularly under the government led by Prime Minister Narendra Modi ji, came up with Mission Indradhanush. That's our universal immunization program, under which we are not only immunizing our small infants and children, but also mothers. So under this program, the idea was to leave no child behind insofar as complete vaccination is concerned. So there used to be a huge number of young children and infants who used to be partially vaccinated. We decided that under this initiative, which has been actually conducted across the country in several phases, now we have been able to achieve almost close to 97% of full immunization of our children. Yeah. And for newborn care especially, we have devised a mechanism under which we have emergency care facilities at the CHC level, at the FRU level. So if there is a sick infant who needs some emergency intervention, then he could be stabilized at the newborn stabilization units, which are existing at the CHC and the FRUs. And after then, they are transferred to the district hospital or the medical college, where we would have the neonatal ICUs or the special newborn care units. So there's both facility-based newborn care, and there is also home-based newborn care, wherein our frontline health workers, who are the ASHAs, they will make a home visit after the birth of the child, and they will go and make sure that the child is adequately being taken care of. And in case they see that there is some difficulty and the child is sick, then they would immediately refer the sick infant and make sure that the infant is brought to the referral facility. So this is how the journey has been, and these efforts are ongoing. We're just building on our success because we are already on the right path, and we're continuing our efforts and adding more and more things so that we could keep our mothers and our babies both safe, because we believe that healthy mothers and healthy babies are the foundation of a healthy India, and a healthy India is going to be a Viksit Bharat.
Absolutely. So the vision is very clear. You mentioned four aspects, that of making India's healthcare system accessible, affordable, inclusive and equitable. So I'll start by asking you about the accessibility factor first, and especially in context of the more economically vulnerable population in the country. We are a vast, diverse country, and our society is quite heterogeneous also in that aspect. So when we talk about healthcare accessibility, how are we strengthening our healthcare access, especially in these areas?
So I would like to begin by talking about the National Health Policy. This National Health Policy, which was rolled out in the year 2017 after a gap of around 20 years. So in 20 years, the health policy wasn't revised at all, and the erstwhile health policy that we had, it only focused on the curative aspect of health. So health meant treating diseases. Right. But when we came up with this new policy in 2017, we made a complete paradigm shift, and we gave a new definition, and we said that now health is not just about treating a disease. Health is not merely curative. Health is preventive, promotive, curative, rehabilitative and palliative. So it's a continuum of care. It's a comprehensive approach towards health. So we are guided by the philosophy of universal health coverage. Now what do you do? The question that you raised, that particularly the diverse population, the huge population, the underserved areas, what do? We have to bring healthcare closer to the communities and in every nook and corner of this country. So we started our approach with strengthening the primary, secondary and the tertiary healthcare system. Now when I say primary healthcare system, this government came up with the flagship initiative of Ayushman Bharat. Under Ayushman Bharat, we created 1.75 lakh Ayushman Arogya Mandir. These Ayushman Arogya Mandir today, which are the closest to the community, they have been completely revamped, because now they offer a comprehensive package of 12 different kind of services, which means you will have mental health care services also, you will have ENT also, you will have oral health care service also, you will even have the screening of the non-communicable diseases. So today, whether it is 3 common types of cancer, oral cancer, breast cancer, cervix cancer, whether it is diabetes, whether it is hypertension, all that screening is being done closest to where the community lives at the Ayushman Arogya Mandir. Right. TB treatment services, screening, everything is available today at the Ayushman Arogya Mandir. And what we are doing is, we are guided by the Indian public health standards. We want to ensure that every public health facility that we have in India today maintains the minimum benchmark of quality healthcare facilities, services. So for this, we have started this entirely new exercise, which is called the NQAS, the National Quality Assurance Standards. And now there are certain conditions that the facilities have to fulfill before they get the NQAS certification. So now all these Ayushman Arogya Mandirs, they are NQAS certified. We have undertaken this huge exercise, and all the other facilities are also going to be NQAS certified. So that's one thing about the primary care. Now coming to the secondary care, so secondary care would mean our district hospital or the sub-district hospitals. So we, post-COVID, came up with Pradhan Mantri Health Infrastructure Mission, for which there is an allocation of 64,000 crore, actually a little more than that. And that is basically to fill up the gaps, the critical gaps which exist in our secondary level healthcare infrastructure. So for example, you need a diagnostic laboratory, for example, you need a critical care block. So all those critical gaps are being fulfilled, are being bridged by way of PM Abhi. And third is, of course, the most important, which is the tertiary aspect of healthcare. So in India today, when we talk about the tertiary healthcare, we often say that, we have less of doctors. So the WHO norm says that 1:1,000, and India does not fulfill that norm. So what do we do? Now, just talking about a problem doesn't solve a problem. So when the government led by Prime Minister Modi ji came up, we decided that we're going to address this issue. And what we'll do is, we will try to increase the number of doctors and specialists in the country. So in this past 11 years, there has been a constant expansion of medical colleges. 157 new medical colleges have come up. So more medical colleges means more doctors. Right. And now we're increasing not just the UG seats, but also the PG seats. So more specialists. So where will all these doctors and specialists go? All the underserved areas, which was your primary concern. Underserved areas have this huge challenge that doctors are not available, skilled healthcare professionals are not available, and specialists are not available. So when you produce more doctors and more specialists, the underserved regions will have a supply of a good pool of these doctors and specialists. So patients will get good emergency care, they will get good routine care. And also it will benefit our economy, because when you have a good pool of medical professionals, you can also attract patients from the other countries. So it's a boost to your economy as well. Apart from the medical colleges, one very big thing that we have done is, before 2014, India had only 6 medical college, All India Institute of Medical Sciences. And you know how much faith people in India have in the All India Institute of Medical Sciences. Our government decided that from everywhere, people don't have to run to New Delhi. So what we'll do is, we will establish one All India Institute of Medical Science in every state across this country. So from 6, now we have 22. And in addition to the medical colleges, we also built up super speciality blocks in 75 government medical colleges. So primary, secondary, tertiary, all the entire pyramid of healthcare has been taken care of, and universal health coverage is our guiding philosophy, and we are moving very fast in that direction. If I may mention about Pradhan Mantri Jan Arogya Yojana. Now what is that scheme? It is the biggest health assurance scheme in the world. Nowhere in the world any country offers such a huge assurance program. Now in that scheme, who are the beneficiaries? It is the people at the bottommost ladder of the society. So 55 crore people in the first step. 12 crore families, which translates to 55 crore people. 5 lakh rupee health assurance, free of cost treatment. Then in the second step, we included 37 lakhs are Ashas and ANMs, the frontline healthcare workers. Then it was extended to the elderly population of this country who's age 70 and above. So which means around 6 crore people. And now in this budget, government announced 1 crore gig workers all over the country would also be brought within the ambit of Ayushman Bharat PMJ. Now that is a reflection of universal health coverage. Nowhere, I mean, any person in this country who's vulnerable, who's poor, who's economically not so sound can have access to secondary and tertiary hospitalization facilities without worrying about from where I'm going to pay the bills of the hospital and treatment.
Thank you. You've already answered all the 4 aspects in how we are augmenting health infrastructure across the country, ensuring quality healthcare to the people as well. So that brings me to the next question on some of the disparities that still persist, and especially, since I said we are a large country with different states, health is the state subject, so the priority every state accords to this area is also quite different. So how is the central government, how is the Ministry of Health and Family Welfare addressing these disparities and the outcomes, the different outcomes that are emerging from different areas?
So like you said, public health is a state subject, and the mandate of the Union Government, Ministry of Health and Family Welfare, is to provide overall broad policy guideline and also offer technical and financial support to the state governments. So while we do this, we actually communicate a lot with the states, because whatever schemes and programs we come up with, the real execution lies in the hands of the state government at the grassroots levels. And it's true that there are intrastate variations, there are inter-district variation insofar as the service delivery is concerned. There are geographical variations also in our state, so some terrains which are very hard to reach, some are not so hard to reach. So those variations, that's the beauty and complexity both of our country. So we try to engage with the states, communicate with them, and we try to offer additional support also, like for example for the hilly states, the Himalayan states, northeast states, or maybe the tribal areas. So there are some additional support which is also being offered. I'll give you an example of it. Say for example, we decided to give one mobile medical unit per district to any ordinary district of this country. But when it comes to a PVTG district, particularly vulnerable tribal groups, so that for that population we will say no, not one, we'll give you more, we'll give you 10 or we'll give you more. So some special considerations are also done for areas which have special kind of challenges. But I would still say that a lot lies in the hands of the state. We constantly communicate with them, and lots of state governments are doing very well, because whatever improvement we see in our national indicators today, that is a reflection of how much effort our states are putting in. There are variations, but then with constant communication, we also try to tell the states that this is where you need to improve, and when you need some support from the union government, we are there to offer.
How are you using technology, or when you say you are making consistent efforts towards improvement? And I ask you this because various tools that have emerged today are enabling transformation in critical areas in more ways than one. So how are the digital tools that are available today transforming India's healthcare sector?
I'll give you an example. I just explained to you about the Ayushman Arogya Mandir. Now, Ayushman Arogya Mandir today have the telemedicine facility. So, the CHO can actually connect a patient who comes to a Ayushman Arogya Mandir to a specialist who is not available at the Ayushman Arogya Mandir, but maybe sitting at a district hospital or a medical college, or maybe some other higher tertiary level institution. Right. So, technology has actually helped us to address this challenge of or that gap which existed in accessibility of equitable healthcare. This is one example, and there are various such examples where we are making use of technology. I'll give you another example of our TB elimination program. We just had this campaign, intensified 100 days intensified TB campaign, which started on the 7th of December 2024 and it ended on 24th of March. So in this 100 days campaigns, we tried to target some 347 high burden district where we wanted to do active screening of the vulnerable population. So we made use of technology. We had artificial intelligence supported handheld x-rays with our team which was going. So they were going to the most difficult areas where there would be no facilities at all. People may not even know they have symptoms or they suffer from the disease. But with the help of technology, we could scan them, we could screen them, we could get faster results. And so many people, much more than our expectation, we were able to identify the TB patients. We thought the missing cases would be somewhere around 2.5 lakhs, but we screened some more than 11 crore people, and then 3 lakh or so or more than that missing cases have come up. So that's the power of technology, and we are making use of technology in a lot of ways because it has the potential to transform the healthcare scenario, particularly in a country as huge, as diverse as India.
Another aspect that I would like your views on is the area of mental health, and because mental health issues in recent years, particularly post-pandemic, have gained significant attention in recent years. And this is one area where it's challenging because of the stigma also attached to mental health issues. So tell us about the steps the government is taking to enhance mental health care across the country and spread awareness about removing the stigma attached to it in the society.
I think what people need to understand is that our physical health and mental health both are equally important. If our body has an ailment, if our body can fall sick, so can the mind. But that's one thing which we still do not believe. We only feel that the body can have issues, but the mind cannot have issues. And I think that's the sole basis of so much of stigma that exists around mental health. So we decided that we will not be able to address the mental health issues completely unless we build more community awareness, and we try to actually break the stigma that exists around this whole issue. So the first thing, of course, was coming up with a policy and legislative framework. We came up with the National Mental Health Care Act, and then we decided on a National Mental Health Program. Now, mental health care services are available to people in all the 767 districts. So, people, if they have any issue with respect to their mental health, they will find the services available within the district that they reside in. And suppose physically they still have an issue, walking up to a district hospital also, walking up to a mental health professional, then we have another mechanism. We have made use of technology. There is this whole big initiative of National Tele Mental Health, under which more than 53 Tele Manas cells have been established. So there is a toll-free helpline number. If you or me or anybody faces any mental issue, these days suicide, depression, all these things are very common, or maybe even more severe cases, you can call upon that helpline, you can speak to the concerned specialist, and that will give you further guidance or relief. So that counseling is playing a huge role. Okay. And I am very happy to say that now people are coming out in big numbers. They are making use of this Telemanas cell, the helpline which is available. And we have recently come up with the Telemanas mobile app also. So that's also in this tech savvy world, that's another instrument that we have given in the hands of the common man, that if you have any such issues, you can even take counseling services by way of that app. The whole idea is to break this barrier, to overcome this stigma and tell people that it's okay if the mind is not feeling up to it. So if we can have problems with the body, we can even have problems with the mind, and it's okay to seek help for not just your body. Of course, for our body we seek help, we go openly, but for a mind also, it is absolutely okay that we seek the help of a medical professional. So our quality of life would improve and we will be able to function well. So when you've raised this question today, I would actually appeal to everybody who's our listener today that mental issues are very common. It's true that at the time of COVID, they got much attention because we were hearing of lots of cases, people going into depression, people committing suicide. But it's not that mental health is some new phenomenon. It's existed since times immemorial. It's just that the awareness was much lesser and it was always hid behind under the carpets. But now we live in the times where we can talk openly about any issue and just understand that both our mind and our body are important. If anyone does not function well, we cannot give our 100%. So we have to be, health is the state of complete well-being. So it's not just physical health, it's mental health, it's emotional health, it's every aspect of our health, even spiritual health. So let's take care of both our body as well as our mind.
Okay, I'll take one last question because time has run out and we've already discussed all the crucial aspects of how we are making a healthier future for India. But COVID had been a huge setback. We saw how even the developed world was struggling, although with the kind of challenges that were posed before India, and our response to it was commendable. But it created a challenge in terms of not just strengthening our infrastructure, but working towards a more resilient future. And the biggest challenge being that we are today the most populous country in the world, and with very limited resources, so to add. So what is our roadmap when we say towards Viksit Bharat for a healthier India 2047? And how are we making our infrastructure or our ecosystem more and more resilient?
No, India's healthcare ecosystem is becoming more resilient, and those are the important lessons that we did derive from COVID. Because when I spoke about PM Abhim, it was actually an effort to fill up those gaps so that any new emerging disease or any pandemic in future could be tackled with. We have now set up a disaster management cell within the ministry. So we are not only training our healthcare providers, we are not only training our healthcare practitioners and hospital administrators and even the district healthcare officers with a view that anytime we face a new pandemic, our entire health fraternity is prepared to deal with these challenges. And I think India is much more prepared now than what it was in the past.
As we wrap up, what is your message to our viewers on this World Health Day 2025? What are some of the simple habits that people can change to work towards a more healthy India and a fit India to add?
Well, World Health Day is a reminder to each one of us that we got to become the warriors of our own health. Governments will play their role, everybody else will play their role, but first responsibility and the primary responsibility is that of a citizen himself. And there are some very small steps that can lead to a big change. You and me can move towards preventive and promotive health by making those little changes in our own lifestyle. So for which we of course have an initiative by the Health Ministry also, which is called the Eat Right India campaign. So what I would like to say to the viewers is eat right, which means you eat safe, you eat healthy, and you eat sustainable. And also fitness has to be our mantra, because in today's world, lifestyle diseases have created a huge burden. So simple modifications in our lifestyle can really go a long way in protecting us against the lifestyle diseases. So any activity that you like, that should be a part of our daily routine. And I feel that it's not a very difficult task to achieve. We all can do it if we really pay some attention to it and we prioritize our health. So let's do it, because we have this big dream of making India Viksit Bharat, and that's not possible if we fall sick or we are not healthy. So a healthy India can be a developed India. So let's take that pledge to become the warriors of our own health.
Absolutely. It's us, the citizens of this country. If we are healthy, the country will be healthier, and we will together make our country Viksit by 2047. So with that, we'll have to wrap up this conversation. Thank you, ma'am, once again for joining us on this program and sharing your thoughts with us and our viewers. To you viewers, thank you very much for your time as well. Wishing you all a very happy World Health Day. Take care of your health and take care also of your family.